So good evening, everyone. Thank you guys all so much for being here. Tonight we're excited to be welcoming Dr. Caitlin Nemec. She's a chiropractor who's passionate about helping people move better through restoring normal functional movement. Caitlin's journey into chiropractic started with a personal experience as a competitive dancer. She dealt with daily headaches that resolves with chiropractic care, and it inspired her career. She's earned her bachelor's degree in chemistry from the University of Winnipeg in 2010 and her Doctor of Chiropractor at Life University in 2014. After practicing in Vancouver for over a decade, she's recently moved to Victoria. We're so happy to have you here, and has joined Victoria Family Chiropractic. She works with all ages and activity levels and has a special interest in biomechanics and whole body movement, especially how it all starts from the feet. So if you can all help me in welcoming Dr. Caitlin Nemec. Thank you for being here.
Thank you.
Have fun.
You crushed it. Thank you. Amazing. Well, thank you so much for being here. Wow. I'm so happy to see every one of you here, and thank you so much, Lynn, for that beautiful introduction, and to Health Essentials for having me. Like she said, I was practicing in Vancouver until very recently, actually back in October. My family and we moved here to Victoria to officially settle down, and our plan is to put down some roots. So when I was looking for places that I wanted to connect with in Victoria, Health Essentials very much stood out, specifically because of their shoe section is what put them on my radar. And then from there, just seeing all the other things that they're just very carefully picking out and carrying, and wow, like meeting Lynn and everyone who works here is just, they're so lovely. And I'm so grateful to be here. So thank you all again. Like she said, I'm Caitlin. We're here today primarily to talk about feet. First, I'm going to show you these cool other people in the photo with me here, though. So that's me, my son Luca, my daughter Ciel, and my husband Dallas, our dog Amma. We hiked up Mount Doug on Christmas Day. That was our Christmas morning hike. So yeah, our plan will be to talk about feet. We're going to talk about how they are connected into the rest of your body. So we'll talk about, I'm a chiropractor. I got to bring the spine into it a little bit as well. We're going to learn how we can help our feet and therefore the rest of our bodies feel good and function well. And really my goal is just that everybody here will leave with at least one little aha moment where there's maybe something that you can look to shift. It might be really small, but it's all the small changes that we can make day to day that will accumulate and lead to a big change in your life and in the way that you feel. So that is my goal. My personal journey into foot health, I would say, did begin while I was in chiro school. So 12 plus years ago now. I actually graduated 12 years ago this March, this month, now that it's March. In chiro school, you were on a quarter system. So you had 10 weeks of classes, a week of intense exams, a week off, and then you'd restart again. So we had a quarter that was focused on the lower extremity and on the feet. And so you had a course where you were learning the anatomy, all the joints, the bones, the muscles, tendons, ligaments, how everything is wired and connected there, the blood supply, the nerve supply to all these things so that they work. We had an extremity adjusting class where you learn how to adjust all the little joints and articulations in the feet so you keep them mobile and moving. We had an orthopedics class so that you're learning all the muscle tests that you can do and the ways and the things that can go wrong in the lower leg and in the foot. At the same time, our school was sponsored by an orthotics lab. So all students were entitled to two free custom pairs of orthotics, which as a student, I was going deep down into this hole of debt. I always perked up at the word free. So I showed up, I got my orthotics. I honestly didn't wear them a ton because for me, they just didn't feel fantastic. Moved on with my life. And I started working at an office in Vancouver where primarily we focused on the adjustment and on the spine. And just by working on the spine, since it is connected to the rest of your body, I was seeing amazing results. I was also often feeling like there was this piece that was missing. Like I had people coming in and in their initial intake, they'd tell me that they had flat feet and I'd be like, okay. And I wrote that down and we never really circled back to that. And I had people who would have knee pain and hip pain when they're walking, where walking is one of the most natural human movements, but people couldn't do that. And people who, after walking, after an adjustment, they'd feel fantastic immediately after, would go for a walk, and then they'd start to slip back into whatever brought them in. So I just felt like I was really missing some specific piece, a big piece, in my opinion. And what I found was actually, first, Katie Bowman, who I have since learned has actually come and spoken here a couple of times, which is very cool. I started fangirling on her, listening to her podcast, reading her books, getting as much of her as I could. And I also tied in with the Foot Collective. When they came to Vancouver, I took one of their courses. More recently, I started studying as much as I could with Gait Happens. I don't know if any of you have heard of them, seen them online. Oh, you should. They're good people to look up. Gait Happens. And I did with them a lot of continuing education courses, which most recently was the functional gait assessment course that they did again in Vancouver. Through all of this, I will say, just as a blanket statement, that I do strongly feel that most of us will benefit by wearing less shoe more of the time. Now, before I have anybody panicking and taking off what they're wearing, there's absolutely a time and a place. There's a time and a place for orthotics. There's a time and a place to have more cushion. There's a time and a place for athletic performance to have specific shoes. But most of the time when we're just walking around, we don't need that much shoe. I came to that conclusion before my husband and I actually took a year plus off to travel. And while traveling, I was returning to my roots. I was going my childhood roots. I was going barefoot as much as possible, which actually, like, by the way, feels amazing. You do want to work your strength and your mobility into it, but just try it out. Let your feet feel the ground. And while we were traveling, I only brought 2 pairs of shoes, and they were very minimalist style. In this picture here, we were doing a 40-day hike through the French Alps. We were carrying everything we were traveling with on our backs, along with camping gear, and usually around 5 days worth of food. And I found my favorite shoes were Earth Runner sandals, which I believe they actually carry here. I wore those for most of the trek. Later on, when we went to Nepal to hike in the Everest region, I upgraded to a pair of Vivo barefoot hiking boots. And I found that for me, my body felt fantastic. I was able to carry a load, move, and travel, and it served me well. From there, though, when I did get back home, and I was so excited to be reunited with a lot more clothes and shoes than what would fit in that backpack, I remember distinctly, we got a COVID puppy. So we came back when COVID hit, got the COVID puppy. I was trying to take her for a rainy walk in my old bog rain boots, and like 10-15 minutes in, my feet were completely numb. I was so uncomfortable. I had to actually get rid of all of my traditional shoes and plunge solely into the more natural foot-shaped barefoot style shoe. And I have not looked back. Now, we are going to shift for just one moment here today, and we're going to talk about housing, which I know was a very popular topic in Vancouver. I don't know if it's quite the same here in Victoria. But we're going to pretend that we all pooled our funds together and we managed to buy a gorgeous, massive house. Well, this house is very big. We each have our own bed and bath. This house is looking onto the ocean with a forest and beautiful trails to walk and run out back. Everything is pristine, brand new, appliances. Only when we get the inspection back on this house, they tell us that the foundation is off by an inch or so on one side. An inch or so, they're saying, not too much. So, okay, whatever, the foundation's off, but we're excited. We want to move in anyway. We haul all our stuff in, settle into our house. But over time, as we live in this house, some things start to go wrong. For example, we have the door that becomes more difficult to open and close. We have this creaky floorboard that's always waking up the baby when we finally get her to sleep. You have a leak that starts happening every time it rains, and a crack forming along the side of our house. A little alarming. Now, we're on a budget. So we decide we are going to WD-40 that window. We're going to hammer down our floorboard. We're going to just do some patchwork and get a bucket out every time it rains. But what do you guys think is going to happen in 10, 20 years if we just continue living in this house? It'll probably get worse. So the better move would be to get someone in who knows how to deal with that foundation, right? Because that's our primary problem. And then we do any secondary repair to the rest of the house. Now, in the body, your brain is constantly in communication with the rest of you through your spinal cord. So as you probably know, your spinal cord is housed and protected by these bones in your spine. From here, so the signals go from your brain down your spinal cord, out all of these nerve roots that you can see are actually going between the joints here in the back of your spine. And from here, these nerve roots, they branch off. Sometimes they join together, form a plexus before they branch off again. And they go everywhere in your body. So much so that if you've ever seen just a picture or a model of the nervous system, it looks kind of like a creepy human. You're nodding. Have you seen that before? So thankfully, with this system in place, we're able to sit here right now and our body's healing itself. It's regulating itself. You're finding a comfortable temperature. Your heart's beating, lungs are breathing, digesting our lunch, making room for supper. Well, we don't really have to think about what's going on just automatically inside of us. Now, in order for this system to function at an optimal level, we need our spine to be within reasonable alignment. We don't need to be perfect, but hey, we want to be pretty close, right? From the front, most people know we want the spine really nice and straight, bones just stacked on top of one another like building blocks. When we turn the spine to the side, you actually want to have curves in the spine, which a lot less people are aware of. These nice gentle curves, they help us absorb shock of gravity as we tend to walk around upright most of the time. And they put the pressure where we want it on the discs, which are these nice cushions that absorb force as we walk upright. Now, what will happen is over time, with stress, with accidents, injuries, repetitive movements, which I'm seeing alarmingly commonly, like using our cell phones and computers, our spines will tend to shift outside of that ideal alignment. And it doesn't take much of a shift before you'll start to have very specific stress points and pressure points throughout the spine and body, which will then lead to degeneration. Also, some people call it arthritis, or essentially a breakdown of the muscles, the tendons, the ligaments, the bones of the spine, as well as those discs of the spine, these nice pillows in here, which will ultimately pay a toll on that nerve and on the nervous system as a whole. Now, the tricky thing is, depending on where this breakdown is occurring, you may feel symptoms such as tingling in the toes, pain shooting down the leg, numbness or tingling in the hands, headaches. All of these things can happen if there is a shift in the spine. Now, one thing that I know some of you have been signing up for is a posture assessment, which is a really cool evaluation. We just take a couple pictures and you're able to see what your posture is looking like, which is a very good indication of what the alignment of your spine is in between those postural points we're looking at. Now, how does this tie into your feet? Well, let's go there. So, are we on the next? So, we were talking about posture, and essentially gait is a person's posture. It's your posture in motion. So when your spine is stacked and you're able to move correctly, a lot of the walking movement is actually going through fascia. You shouldn't be spending a ton of energy while you're walking. However, what you do have going on is a lot of a very repetitive movement, because your gait is going to also be an indication of any kind of accident or injury that your body is compensating for, if that makes sense. So you might see, I mean, a big example is if someone has a limp, right? If they have something going on in their hip or their knee that's causing them to limp. But it could be minor things, like if you have an ankle injury and you're always going on the side of your ankle, that will actually change the way the impact is going through the foot, up the chain, and into your spine. Now, when you're running, if anybody's here is a runner, you think of your walking and how repetitive that is. You're actually adding with running 2 to 3 times your body weight of force into your body with every single step. So I'd say if you're a runner, your alignment becomes even more important. And here we are, ready to properly tie together the foot to the rest of your body through something called tensegrity. So in this picture here, this tensegrity structure, has anyone seen one of these before? No, I should have one, really. But we have these, it's hard to see. There's these yellow, they're like elastic ropes that are connecting together some red poles, some nice sturdy poles. So if you can imagine on this structure here, if I were to pull one side of it, it's going to compress and change the shape of the structure as a whole. I see some nods. I'm making sense here. So that is a tensegrity structure. When we take that and we apply it to us, to the human body, we call it biotensegrity. Bio for living, right? Human life. So these yellow, stretchy bands, if you will, are now our connective tissue. Our connective tissue or our fascia. Includes your muscles, includes your tendons, with the red being like our bones. So these bones are able to move due to compression change and pressure added to the connective tissue. Am I making sense here? We're nodding a bit? Okay. Now, Thomas Myers with Anatomy Trains, he does a lot of really cool dissections actually into the body, and he's dissected out and discovered 12 different very strong fascial, he calls them trains or chains or lines that go throughout the body. So you're connected through these 12 chains that essentially hold you together and allow you to move. Really cool stuff. And two that I pulled up, oh, we can't see the name. Two that I selected for us here, there we go. We have the deep front line, which goes from the big toe up through your shin into your adductor, like your inner thigh. Direct connection from your big toe up into your pelvic floor. So if you've ever had an issue with pelvic floor health, a place that I would encourage you to look is actually the big toe. Because your big toe, as you're pushing off in your gait cycle, you're hardwired in to have an appropriate response in the pelvic floor. Okay? Pelvic floor, it connects to the psoas. As a chiropractor, I don't do a ton of soft tissue work. One muscle that I habitually check is the psoas muscle. It's a very strong hip flexor that goes from the front of your spine and connects out to your leg. In this deep front line is also your quadratus lumborum muscles. Are these guys here that tend to be, they tend to get cranky in a lot of us. Goes up through the thorax into your masseter that is involved with chewing, TMJ joint, as well as your temporalis muscle up in your head. So direct connection from your big toe all the way up through the spine to the head. Then we have the superficial back line, where some of you may have heard of the plantar fascia on the bottom of the foot. Goes through your calves, your hammies, your erector spinae, that's those strong muscles on the sides of your back. Connects to the base of your skull here in your head before wrapping over into your scalp. So every step in your foot is going to have an impact all the way up into your head and neck. And there's actually been a study done where, I think it's actually Katie Moman who I learned this from first, where if people aren't absorbing force correctly in their foot, you can almost get a whiplash-like injury in your head and neck because the force is going through that fascia right up into your neck. Actually, a way that you can feel that right now is just everybody kick a foot out, nice and straight. Do we feel a bit of a pull? Maybe down the line. Now try bending your head down and see if that makes it any bigger, stronger, more feeling. Do we want to stop? Nice stretch. So that's your fascia. That's you're pulling on it now from both sides of it. Okay, cool, kind of cool. We're feeling things. All right. Fibers of fascia, they're organized or disorganized based on our use pattern. So the way that we're moving and using our body habitually, your body is going to get really good at that. It's going to dial it in. So everything that is a habit, your body, it wants to be good at. Tensegrity, biotensegrity. So I like this quote here, a system of dynamic stability. And when we move one area of the body, we create tension and compression throughout the entire structure. Cool. We did it. That said, I would say especially in the superficial back line, but with any line of fascia, it can be very powerful to find the window into where specifically we need to address it, where your body needs it the most. However, I will say that it's clinically the most effective if we're able to address it anywhere that is weakened along the chain. So addressing the entire fascial line will typically lead you to better results, which is, in practice for me, I really like to look at whole body. I make sure the spine's moving, but I like to look at you as a whole. Okay. Now, the star of the show tonight, I did promise we were going to talk about feet, so let's do it. Here's your foot. It has 26 bones, 33 joints. When you combine the muscles and ligaments, you have hundreds of them. Over 200,000 nerve endings per sole. So that's the bottom of your foot, the part of your foot that's in contact with the ground. Your feet are made to move. In fact, when you just look at this picture here, is there another body part that this resembles to you? Yeah. Your feet and your hands anatomically are very, very similar. Functionally, with how most of us, I mean, me too, my feet spend a lot of time in socks and a lot of time in shoes. We've lost a lot of that ability in our feet. And it's amazing. Well, have you ever seen people like painting with their, like the things that some people can do? You can too. We just need to wire it, right? Wire it and practice it. A couple fun facts, not funny facts. The calcaneus, so that's your heel bone, is an amazing shock absorber. So a lot of us think we need a lot of cushion in our shoes to absorb shock. It's built into your body. So your calcaneus being your heel, it has a hard layer of bone on the outside, and then it's actually a spongy bone on the inside. It is designed to absorb shock, and it's really good at it. Your big toe, your first ray, your hallux, all same names for this, different names for the same thing. Twice as wide, roughly, as all of your other digits, 4 times as strong. So it's something that, especially if we've ever sprained our ankle, we tend to have a lot of tension and compression pulling us to the outside of the foot. Really, really important to get that to release so that we can get ourselves walking over our big toe. It's where your body wants to be. Am I making sense? We like the foot. They're really cool structure. Has anybody heard of pronation, supination? Has anyone been told that they pronate? Are we worried about pronation here? Okay, so this is where I mentioned before, I'm not anti-orthotics. I'm anti just adding orthotics and support and extra cushion to a structure without having a plan to also strengthen and work on it. There are certain structures where, yeah, just the way that a body is formed means that you could really use that support more long-term. I'd say for most of us, the vast majority of us, we're adding a lot of support to a structure that doesn't really need it. Your foot is meant to move, and it's meant to be strong. It's the one part of the body where we habitually add support and we brace it without a plan to get out of it. Like imagine if we wore a neck brace every time we had neck pain with no plan to strengthen and get out of it. There'd be a lot of us, right? Probably quite a few of us. So pronation, it's been given a bad rap. It's actually a really cool thing that your body, your foot is designed to do. There's something called pronation expression, where first our calcaneus, that beautiful shock absorber, hits the ground, then our foot hits the ground and it unlocks. The structures that we were looking at in the last slide here, they spread out. You have all these beautiful intrinsic foot muscles that they should be controlling that spread out. So pronation is an issue if we're not controlling it. It's also an issue if we're not able to get out of it. So with pronation expression, hit the ground, foot spreads out, toes splay, that's another word for your toes spreading out. And the toe splay actually triggers to your brain, okay, we're ready to take off now. Along with your foot pronating, with pronation expression, your knee will rotate, your hip will rotate. You'll have a rotation of the pelvis that goes up your whole body. So walking is a whole body movement. If your foot isn't properly pronating, that is where often you'll just slap the foot down and a lot of the pressure, the force will go elsewhere, right? We want it to be working as a whole. Pronation expression. And then there's also a supination expression. So supination is another good thing in the right dose, at the right time, the right place. After your foot's spread out, we go back into our rigid lever. Everything rotates the opposite direction so that we're ready to push off and effectively walk forward. Has anyone been told that they have a flat foot? Are we concerned about flat feet here at all? So the cool thing about a flat foot, flat foot, just based on appearance, is not a fantastic diagnosis. Because your foot can actually be flat. Our feet are allowed to be different shapes. In fact, if you take off your shoes, you should be able to lean forward and get your foot to flatten out and pronate. Sometimes you'll have that flat foot appearance in a foot that's actually very, very strong. This foot right here belongs to the fastest sprinter of all time. It's Usain Bolt. Still holding the world record. Look at how flat that foot is though. I would say most likely we got some very beefy, strong, intrinsic foot muscles on this guy. Not something that you need to panic about. And I know we mentioned before that you can do a posture screen. This weekend is filled up, but we do have dates available for next Saturday where you have the option to do a posture screen as well as a test for how strong your intrinsic foot muscles are. You can get a number behind how strong your toes are and compare it to what your ideal would be. Gives you a bit of motivation perhaps, or maybe it'll just pump your tires if your feet are really nice and strong. But there's this foot dynamometer here is the tool that I use to actually test how strong your toes are. Okay, Usain Bolt. And here we go. Some more feet. So we were talking about pronation, and here's a cool picture of just what exactly happens as we pronate. So as we pronate, like I was mentioning before, your foot unlocks, your toes spread. Then we have these deep transverse metatarsal ligaments. They'll spread out a bit, right? As your toes are spreading, they'll pull on those. That is what actually triggers to your brain. All right, we're done absorbing shock. Let's get ready to move forward. So it'll get you out of that pronation and back into your supination to walk forward. This one thing, I will say, makes me very, what's the right word? I feel very strongly that if you're gonna change anything or look for any one feature in your shoes, which we'll talk about what makes up a shoe in a moment, make sure that your toes can spread out. You want your toes to be able to do that. For one, it'll feel way better. It'll be a lot more comfortable for you, but also you'll have better alignment of your big toe and you'll be able to have that toe splay. That gives your foot a chance to actually trigger to your brain to get out of pronation and start moving forward. Okay. Now, along with that, we also have something called a windlass mechanism, which I mentioned in here. We want our big toe lined up properly. Your big toe 4 times as strong as your other toes. It's meant to hold a lot of force, to generate a lot of force. With the windlass mechanism, as we start extending over onto our big toe, it actually, through your plantar fascia, it pulls this is that calcaneus we were talking about, your brilliant shock absorber. It pulls it back in towards your big toe, which pops up your beautiful arch, puts you in a rigid lever so that you can start moving forward. So we want space for our toes. How do everyone's toes feel right now? We feel good? Amazing. Okay. This picture here, something that we don't want. Is anyone struggling with a bunion? If you think about the shape of a foot, and we do a good job with like babies, knowing that they want to have space for their toes. We don't do such a good job for us grown-ups, right? So you look at the shoe and you look at what your toes are forced to do in it. That's definitely going to be a part of it. With bunions, I would always want to look at the toe strength. I'd want to look at what the hip is doing. Because if you have a really tight pelvis from a lot of sitting and your feet are maybe rolling out like so, then you're walking here, pushing that big toe out, right? Instead of getting over the big toe joint. So there are a lot of different ways that you can look at that. A really cool tool that I was excited to see is actually on sale right now are the toe spacers, where you can put them in between your toes and it helps to actually better align your feet for you. It's something that, like orthotics, if you're not used to spreading your toes and having something in between them, you'd want to work your way in. Start with like 5 minutes or so, but this could be a good evening routine for maybe some of us who have been cramping our feet for any amount of time. Bunions, it's also known as hallux valgus. It's something that 1 out of 3 Americans have, and more women than men, which if you think about our pointy high heel shoes that are usually cramming our toes in, makes a lot of sense. Has anyone struggled with plantar fasciitis in here? Yeah. Okay, so that's another one. We were talking about the plantar fascia, the brilliant connection from the foot all the way up into the head, and that can be a tough one. I'm really sorry. I know it can be very painful. 1 out of 10 adults have it, roughly. A study that was done over 20 years ago it was people who had such bad chronic plantar fasciitis that they had surgery for it. So they took some samples out from the tissues they were using in the surgery. And let me back up a sec here. Hold on. So plantar fasciitis as a diagnosis, you can break up the Latin terms in a diagnosis typically that can help you understand what it is we're dealing with here. The itis means inflammation of the plantar fascia. So plantar fasciitis as a diagnosis means there should be inflammation there, or extra blood flow, right? Like extra blood, inflammation, white blood cells, you name it, should all be there. When they were studying the biopsies on people with plantar fasciitis as a diagnosis, what they found was actually dead tissue. They weren't finding any signs of inflammation. It was dead tissue. There were tears in the intrinsic muscles and the plantar fascia. And what they came to conclude out of this study was that it's not inflammation at all. It's a issue of not having proper circulation to the foot, to the plantar fascia. So they found small tears in the tissue, death in the plantar fascia and intrinsic foot flexor muscles, not inflammation, and the entrapment of the posterior tibial artery. So the posterior tibial artery, it comes down through the lower leg, and then it splits off into these guys here. So it's the lateral plantar, medial plantar. It supplies the plantar fascia as well as the intrinsic muscles in your foot with blood. This is a good thing. We want that. This artery becomes entrapped when the big toe is in an adducted, that means going towards the other toes, extended, pulling back on it, position, which if we go whoop, go back here, it's essentially the same position that a lot of our footwear is putting our feet in. Okay, has anyone heard that before? That's kind of, that when I learned that, it actually made me mad. I was like, oh my goodness, like we have all these poor people with plantar fascia and all these shoes that are forcing our feet into that compromised position. We need blood flow to the feet. So let's have a look at what we are putting on our shoes, on our feet. So these are just some examples of shoes that I pulled up. It's helpful just to know all the terminology around what goes into a typical shoe. So we have something that's called heel drop, which I tried to find in all these models here. So heel drop is the difference between what's under your heel compared to what's under your toe. A lot of people, they'll come in and they'll tell me, oh, I never wear heels, but I'll see you wearing shoes that I know got maybe not 3 inches, but it has somewhat of a heel drop. This one, it's over 1 centimeter in a running shoe, 5 millimeters in the Hokas, 8 millimeters in the Asics, only 5 in the Blundstones. That's actually less than I thought it would be when I was looking that up. really important to know, especially if you have anything like pain in your forefoot, right? Or bunions, if you're adding extra load to that front part of your foot, it's something that maybe you want to back off of. Then we have a stack height, or the amount of cushioning essentially in a shoe, which it ranges. I mean, there's up to like 3.5 centimeters, 3 centimeters, 36.5 on the A6. You can have a lot of cushion under your feet, which again, time and a place. It's okay to do it sometimes. I would say all of the time, we probably don't need that. Ankle sprains. If you're standing on a structure that's this high and it's rigid and it's not allowing those beautiful bones and joints and muscles of your feet to move, and then we go over a bit of a curve, the force really has nowhere to go other than straight into your ankle, right? Whereas if you're if you're barefoot or in a nice flexible sole that allows your foot to move, you can actually absorb a lot of that force elsewhere. Ironically, I was actually doing a shoe trial at Front Runners. They let you just go and try on different running shoes, go for a run in them, then you give them back. And I was like, okay, I'm going to try the sock. And he's like, let's just see what happens. And sure enough, I stepped over a curb and I rolled my ankle. And I was like, oh, I haven't had this happen in so long. Like, of course it would be today. So I'm living, I'm here, and I'm here to tell you, look out for that. Then a lot of shoes, well, we're going to take a look at our own shoes. They have a tapered toe box without necessarily telling you that that's what they're doing. Even wide shoes, it can be very confusing in that there are shoes that are marketed as being wide, but they'll be wide like here, but not so wide where you actually want it to be at the toe. Was I missing anything? You have heel drop, and toe spring. So that's something else that in a lot of these running style shoes, which people tend to be wearing all the time now, the toe spring is how this foot is coming up off. See how the toe's coming up off the ground, so it's like kind of rocking you forward, which again, especially if we're tapering at the toe box, that's putting your big toe in the double whammy, the adducted and the extended position. We don't want to do that. We want your big toe to be able to contact the ground and to do so in proper alignment. Okay. Are we ready? Are we ready to look at our own shoes? We're gonna need to be barefoot at some point tonight anyway. I mean, if you're shy about it, you don't have to. But I'm gonna go for it. My husband got me some new nail polish yesterday, and my son and daughter were both very excited about it. So as soon as it came out of the bag, it went on all of our toes. So I matched my little kiddos. But taking off your shoes, I'm the only one? Oh, okay, there's more, there's more. It's a good thing to look at. This is an interactive workshop, by the way. Take off your shoe, take off your sock, and take out your insole. Is a little foot check. So what you do with this test, and if you're not doing it right now, I understand, but I do encourage you to try it out at home with a variety of shoes. It'll be different in the different models, but you put that insole on the ground. Oh, I see some good ones up here. We already know what we like. Then you put your foot on the insole. Ideally, you'd be standing because that's what we're often doing when we're in our shoe. And you just try rocking forward. So you get that foot unlocking happening as your knee comes forward over your toes. Even see if you can feel your arch pushing down. Pronation is good. We want that to be happening. And your toes should be spreading. And notice if your insole is wider than your toe, or if it's maybe, do one at a time. Like put one foot forward. So we're going to come in like a lunge here. Just move this foot forward with me. Yeah. And then we're going to rock right forward. See how that pinky is wanting to go off?
Yeah, my feet are terrible because I wore those bad shoes for a very long time.
I mean, it's maddening, actually. That's just normal, right? It's something that's anatomically not normal, but I'd say common. It's very, very common. And it's like you need to really deliberately seek out shoes that won't do that to you, right? I know the Vivos, I agree. When I like did this check with my Vivos, I was like, ooh, I mostly make it, but it's like not quite, it's not quite where we would like it to be. Okay. Oh, yeah, okay. So what we want to see, okay, it's a bit easier with this sock off, but what you want, so everybody, the foot that you're testing, you want in front of you. So you're gonna be in a bit of a lunge. Yeah, and then you're gonna rock forward so your weight's really going on that foot. Yeah, and notice how, so bend this knee, rock forward on here. Notice how your pinky wants to jut over and your big toe, like it wants more space here. So your toe can expand, it can pronate. Your foot isn't letting it, or your shoe isn't letting it, sorry. It's inhibiting that movement in your foot. Hokas are not too bad. They're an interesting, oh yeah. Yeah, like that actually seems to fit you. It's decent.
It's
yeah.
what?
It's a decent fit for you. Like, see how your feet are still contained within.
I'm doing the Camino. I got some.
You're doing the
Probably
Camino.
Bondi 9, I think. Bondi 9.
except for
I think that's my next shoe.
Test them
I
out.
just Googled it.
Do the
It
test.
does have, but I've tried on so many.
Yeah.
And they're the only ones that are wide enough
Okay. Yeah.
to put extra socks. So that's
Right.
why I went with that.
Yeah,
So I don't know if it's the best one, but it's the only one that didn't.
I mean, as long as if you can spread those toes in there, that's better than a lot of shoes. So that's what we want.
When you
And
talk about the toes players, are you talking
Yeah.
about in your shoes or just sleeping?
so I'd say not either of those to start. I would say start with like 5-10 minutes while you're like watching TV.
I used to wear yoga toes.
Oh yeah, okay. So you already have. And then you can try like walking around. You could try sleeping, and yeah, ideally, yeah, if they will fit within your shoe and it's comfortable for you, it's a great thing to have in.
I don't know.
Probably not in Hokas. Yeah. They're not too bad because they really do fit within your foot. Yeah. Any other questions? Have we all? Yeah. Yeah. Exactly. Yeah. It's restricting your movement, right? Which there's a ton of good ones just around the corner here. This store is amazing for that you can actually try on. It's, yeah, a really, really special thing, which I will say when I first got on this journey, I was like ordering online and hoping that things would fit. And yeah, it's a gem. It's a great place to start. Oh yeah, we'll leave our shoes off. Yeah. We need our feet. We need our feet. No, that's a great question. Please don't. Just don't. Everybody just feel the floor right now. Don't your feet feel alive? Yeah.
I know there's a couple people who practice walking on their like tippy toes, like kind of step each step on the front part, and it kind of engages the calf a lot. And, kind of uses different muscles. I wonder, yeah, do you know much about that?
Like for an exercise, it sounds not like a bad thing. I'd say for regular gait, it's not really what. Oh, running's a tricky one. That's yeah. That's like a whole nother. Yeah. I would say running. It's You do want to be a bit more mid-footy, but that said, like, I don't hate heel striking. It's just you gotta like play around with it a bit with your stride. And I'd say running, your posture and what's going on above your feet becomes even more important, right? Do you like to run?
No, I
Okay.
like to work.
Okay. Yeah. I do that too. Yeah. Okay. So it's good to like know what you're doing then. Yeah. Okay, that was our test of the night. Now, at-home foot care. So here I've put together some of my favorite things that we can start doing for our feet, which I'm going to say this does not have to be a daily routine. It's maybe even a little bit long to do every single day. Choose like, you want to kind of rotate it, right? Like choose like 1 or 2 per day. And like I said earlier, it's like if you're able to do 1 or 2 things a day continually, it's better than doing like all of this for 60 minutes on a Saturday, and then we ignore our feet for the rest of the week, right? So thing number one is to roll our feet. I have a few of these. I'm going to need them back afterwards, but with a ball. Does anybody have a football? A football at home? We have footballs. They sell some good ones here. We're going to have to pass these around because I only have, I don't know, 7 or 8 or so. But starting out with rolling our feet. You actually do, there we go. I'll keep one so I can show you guys what I'm planning on for you here. But what we want to do, oh, I got another one. Okay. Oh yeah, you're ready. Let's pass it back. Thank you. And we'll try and take turns with these. But rolling your feet, ideally, actually, you know what? Who wants this one? I don't need a. Okay. This is my foot. We want to go, I like to always start with up and down, getting your whole foot from the ball of your foot back to your heel. Then I like to plant my heel down, get the ball kind of right in your arch, and we're going to go over it, trying to unlock that foot. I'll say it's definitely a bit easier if you're standing up, so you can really like get your weight on it. Does that feel like it like hurts so good?
I got a little bit
Kind of in the arch.
I got a little tender.
Yeah, it often is. So put like just the right amount of force, right? So after we've done a little TLC in our arch, I like to go right under the knuckles, like the knuckly part of my foot, get the ball right under there. Again, heels planted down, and you're trying to go back and forth on the ball to like make these guys pop out. Yeah. Yeah. See how you're going kind of around it? Yeah, like that. You want to try and get those knuckles to just pop out at you. Yeah, you can use a cup, use whatever you have. You want to get your whole foot. Ideally, I'd say doing this for around 2 minutes a foot. Perhaps you could put a ball beside your toothbrush. If we already have the habit of brushing our teeth, you want to pop that on the ground and do some of that as well. Honestly, like since I started habitually rolling my feet, I've noticed that if I have tension or pain along, especially that superficial back line we were talking about, after I've rolled my feet, it always feels at least a little bit better. In fact, if any of you have tight hamstrings, a fun test to do is to try stretching them out first, roll each of your feet for a couple minutes and see if you can go a bit farther because you've taken some of the tension off of that line of fascia. Okay. How does your foot feel?
Okay.
We're okay. Okay. Okay, so we're going to practice rolling our feet. Just kind of pass along the balls as much as you can. Then the foot handshake is one where we become our own toe spreaders. And while we do this, we're also, it's beautiful because you're working on ankle, knee, hip mobility to just get your hand to your foot. I'd say better done sitting down, but here we go. You want to try and interlace your fingers between your toes and get, oh man, I got some fluffies here. Get them in there as far as you can. And then while we're here, you're spreading your toes with your, and yeah, we're starting to move it a bit. So it just kind of comes naturally, right? You can move it. You can try like even, I always love to grab onto this called your navicular bone in the arch. See if I can like release that a little bit. I sometimes get a nice little click. Great time, if you, especially if you had an ankle sprain, to work on the top of your foot, kind of massaging in between where the bones of your toes are going. Try to release some of that. Couple minutes a foot. Do both sides. Does that feel like kind of weird, kind of good? The foot handshake. Then something called happy feet. It's actually something that I learned back when I was a tap dancer, but came back to me through just more recent foot studies. The happy feet is I just like to try and unlock the front to back. So the happiness is as you're up on your toes, see how you get a nice little smile here, right? Happy feet, happy feet. I even feel my calves activate while I do this. You want to try and make sure that the ball under your big toe and the ball under your pinky toe both stay on the ground as much as possible as you rock up and onto happy feet. If you're feeling like doing some calf raises, I mean, fantastic too. Great way to drill in some supination, especially if we're pushing down and rooting those big toes into the ground. If you have, again, ankle sprains, tightness on the outside, you might find yourself really wanting to roll out. If that happens, I'm sorry? Yeah, oh yeah. You have a happy feet? Let's see. You can definitely do it sitting down. Yeah, yeah, and just making sure that you're really pushing through that big toe. Get this on the ground. Yeah, feel that difference there? Yeah, big toe down. Yeah, yeah, great question. Thank you. Yeah, your big toes are meant to be used. That's the happy feet. Then we have move your toes. Has anyone heard of toga? No? Yes. Okay, I was like, this has got to be a crowd that knows a little bit about toga. So then let me introduce you to toga. You can do it sitting down. Thinking about your feet as a tripod, we want to plant the ball under your big toe, the ball under your pinky toe, as well as your heels. They're all rooting down into the ground. Then we're going to try to only pick up your big toes. Put it down. Try and only pick up your other toes. And put them down. Only the big toes, only the other toes. So you want to try and keep that ball of the pinky toe. That would be another point that you want to work on. Yeah, great question. It could take a lot of practice just to lift your big toe. You might need to stare it down. You might need to like hold down your other toes with a hand and just move the big toe and watch it happen while you rewire your brain down to those feet. And that is okay. That's just part of the process. And one day it's going to wiggle. You'll get that big toe to wake up. You can do it. You can rewire it. Your body is meant to rewire like that. Something else that you can play around with is adding resistance. I'd say it can actually help with the process where you actually band around. So I'm standing on it and it's like a little hammock around my big toe. Now, especially important if you have a bunion, but I'd say for everybody, you want to try and make sure that big toe is going straight up and down. It's like look in there, make sure it's going straight. And you can do like 20 to 40 of these. I should say, by the way, it's very normal to get cramping. And it could be quite alarming. It could even be like almost a spasmy feel, but that's the rewiring happening. You're waking up muscles that maybe haven't fired for a while. Does anybody want to try? Cramping's a good thing. Yeah.
The more you cramp, the better.
I mean, don't like try to cramp, but like, but like, don't be scared of it either. Like, give yourself a break. Maybe massage it out, a few deep breaths, but it's a normal part of the process while you're waking up your feet. Oh yeah, thank you. Anybody else want a ball? Do some rolling, thank you. Anybody else want a band? So you can put it around your big toe and then you have it, you want to stand on it, get it like under your heel. Yeah, and then around the big toe. And then you hold, so you can control how much pressure you do there and just up and down with that big toe. So you hold this and your big toe's going up and down. Yeah. Yeah, there you go. There you go. And then you switch so that it's around the lesser toes as well. But I'd say big toe is way more important. Big toe's the star of the show tonight. Anybody else want? No, I got lost. You guys. We've all put our shoes back on. No. Along with toga, there's also, it's called with the same tripod, so ball of the big toe, ball of the pinky toe, and heel are on the floor. You can lift your toes, spread them out, and try to reach them forward and down as much as you can. A lift, a spread, and a reach. For like you're trying to grab something out there with your toes. You don't want your toes clawing like under you while you're moving them. You want them to be able to lengthen and relax down.
Sometimes get calf cramps doing that.
Oh, you could. Yeah. Yeah. Thank you. Okay. Then another fantastic exercise that's great for your feet as well as for your whole body is, thank you, is to work on balance. Single leg balance. It's a great one. I'd recommend doing it without shoes on so that you're more connected to the ground. Improve your chances, right? I always like to improve my odds wherever I can. But again, thinking about that foot tripod, balance on one leg, you'll feel it. I feel it in my foot. My ankle's like got a little shake to it. You can progress by trying out some stars, maybe closing your eyes, trying not to let your legs touch while you're closing your eyes. The tendency will be to, whoa, let's balance, but try to just balance. Another really cool progression for balancing is something called a Mobo board. Has anyone heard of this? Yeah, you're nodding. Okay. So I actually happen to have a spare one that's very gently used that I'm planning to have a Mobo March for. I've not figured out yet the logistics of how people do giveaways online, but I want to do one and I want it to be local. So this one is, it's up for grabs for somebody. The way to follow along will be on Instagram. That's my Instagram right there. I'll post it in a while. We'll see. But this is a really cool tool. It was made by a physio down in the States who has really just driven home how the foot connects to core, and he's actually very into running, so he's very into how you can maximize your posture and your alignment for better running. This thing was designed so that you're forced to drive through that big toe. You don't have anywhere else to put your lesser ones. So it's a fantastic way to work on balancing while you can add a bit of a rock to it. It has different numbers so that you're challenging different areas of the body depending on how you set it up. And when you want to do the other foot, you just flip it over. These guys come out and they go in. So it's really, really well thought out. I was so stoked when he actually reached out to me. He was like, hey, do you want a new Mobo? And I was like, yes, I can't say no to this, but now I have one to give away. So here we go. Last few things for cleanup here. Saturday, so we did open up some spots for actually like a week from Saturday. I think it's the 14th, where I'll be in the store and we can do posture checks as well as we can test how strong your toes are. So you've got time to work on it between now and then. This is your motivation. Mobo March I mentioned. And then I am at Victoria Family Chiro. So if anyone is looking for a chiropractor or is just intrigued by what you learned tonight and would like a full body, full spine assessment, I would be honored to do that. A great way to stay connected, whether or not you want the Mobo, is by following me on Instagram. I've been trying to get out really just quick, short videos with helpful tips and tricks that can get you thinking throughout the day. Or if you do have any questions and you don't have Instagram, you can also contact me through email. I think that was maybe it. I'm sorry. Oh, where am I located? I am on, I'm like right across the street from Hillside Mall. It's like North Derry in Shelburne. In the same building as Shelburne Physio, if you know them. Yeah, yeah. I joined Dr. Kale there. I don't know if you know. Kale Copeland. Yeah. Any other questions? Yeah.
You mentioned earlier
Yes.
about the connection between the big toe and the jaw.
Yeah.
And I have a ringing in my ears.
Oh, yeah. Uh-huh.
Have you ever, has anybody ever asked you if that has anything to do with the connection to the big toe or not? I mean, I'm
Yeah.
thinking everything, right?
Right. Have you tried a chiro? Have you?
Not for that.
Okay.
Not for that.
Yeah. I feel like it's an avenue worth exploring. Immediately, my brain honestly does not go to the foot for that. It does go to your neck, where I've had a few cases where that has actually improved. That said, there's so many different possibilities. So Yeah, unfortunately, I can't really yes or no that right now. But I mean, working on your feet to absorb shock could put less pressure in there. Thinking about your head and neck alignment, it would be very interesting to find out. Yeah. Yeah, great question. Any other questions?
I have a question
Yeah.
again about the toe separator.
Yeah.
Does that eventually, when you use it, eventually keep your toes separated? Like, is that the purpose of it?
Right. So with the toe spacers, essentially what you're doing is you're doing like the opposite of what a traditional shoe will have done for years. So some people do wear them almost all the time. Some people, so it puts your foot in a better position so that you can strengthen, right? So you want things to be in alignment so that they can fire properly.
And maybe over relief too.
Yeah.
After a lot of walking.
It could. Yeah, it could be a great thing to throw in the pack. Yeah, right? Yeah. Oh, texture. It's such, your feet crave it, right? Yeah. Yeah, 200,000 nerve endings, right? They're craving texture and temperature and all of they want to feel and they want to send that input up to your brain so that your whole body can adapt to what's going on at the ground. Yeah. Yeah. Okay. Any other burning questions? Amazing. Well, thank you again so much for being here. Thank you. I would love to hear if there's any like tidbit that really stuck out to you. Just let me know. Amazing shoes around the corner, toe spacers on the counter, sign up sheet for posture. I think that's all we need.